Cholesterol is a type of fat found in all of your body's cells. Your body needs cholesterol to work properly. In order to get to all of your cells, cholesterol needs to travel through the bloodstream. Proteins form a shell around the cholesterol, making a cholesterol complex. It is then released into the bloodstream and travels to where it needs to go. A protein that is linked to cholesterol is called a lipoprotein. You have probably heard about good cholesterol and bad cholesterol. The cholesterol complex, or lipoprotein, that can be bad is called LDL. LDL stands for low-density lipoprotein. Normally, LDLs transport cholesterol from your liver and deliver it to the tissues that need it. But if you have a lot of LDLs left over after all of your tissues have been taken care of, the LDLs will let go of the extra cholesterol while traveling through your blood. The good lipoprotein, which is also the good cholesterol, is called HDL. HDL stands for high-density lipoprotein. HDL is good because it picks up the extra cholesterol that was dropped off by the LDLs. This is why it is good to have high levels of HDL in your system and low levels of LDL. Think of H for high to help you remember this about HDL. And L stands for low, which is a way to remember that you want low levels of LDL. For most people, their internal cholesterol gauge works well enough to keep their cholesterol at a good level. However, if your levels of cholesterol are too high, LDLs will leave extra cholesterol in the blood. If the HDLs cannot pick up all of this cholesterol, it will begin to build up on your artery walls, along with other fats and debris. This buildup is called plaque. Over time, plaque can narrow the blood vessels, and sometimes this buildup may even block your blood vessels completely. Plaque buildup on your blood vessel walls is called atherosclerosis. A narrowed or blocked blood vessel can prevent blood from getting to where it needs to go. If the blocked vessel is in your brain, it can cause a stroke. Blockages can also happen in the blood vessels called the coronary arteries that carry blood to the heart muscle. This blockage process is called coronary heart disease, and the end result can be a heart attack. Lifestyle changes are the first line of treatment for a person with high cholesterol. Lifestyle changes include changing your diet, weight loss, exercise, and quitting smoking or nicotine use. It may take 3 to 6 months before you and your healthcare provider see the full benefit of lifestyle changes on your cholesterol level. Generally, the first thing a person with high cholesterol should do is eat less fatty and cholesterol-rich foods, and eat more foods that are low in fat and cholesterol. Your healthcare provider can help you set goals and figure out the best diet for you. The more weight a person gains, the more their cholesterol tends to rise. Just a little weight loss can decrease your cholesterol level by about 10%. A moderate exercise program will help you keep your heart and blood vessels in shape and lower your cholesterol. Exercise will not only lower LDL, which is the bad cholesterol, but it will raise HDL, which is the good cholesterol. Be sure to check with your doctor before starting any type of exercise program. Nicotine can make blood vessels narrow and lower HDL. If lifestyle changes alone are not enough, your doctor can prescribe cholesterol-lowering medication.
As you have seen from this presentation, cholesterol is not a bad thing. It does serve a very important purpose in keeping the body healthy. Unfortunately, some people who have high cholesterol choose to ignore it because there are no obvious symptoms. Having high levels of cholesterol for long periods of time can greatly increase your risk of serious medical problems like heart disease, a stroke, atherosclerosis, and other heart and blood vessel problems.
Even though it is a serious problem, commitment and care from you and your healthcare providers can help control high cholesterol. You now have a lot of information about this condition, which includes treatments such as making lifestyle changes and possibly taking medication. Whatever the approach you take or the condition you're in, making a lifelong commitment to lower your high cholesterol is a very worthy goal.